Right. So, hi friends. Now we are continuing the session, okay, which we have already discussed about the radiation and we discussed about some of the important points. Now it's time to understand regarding the investigations, okay. So we need to understand what investigations we're gonna deal with, and the next point to understand is so now the investigations are based or they are divided on two important aspects, the one which give ionizing radiations and the one which don't give ionizing radiation. Okay, the one which give ionizing radiations, the one which don't give ionizing radiation. Under the ionizing radiation, which I have already discussed, in the electromagnetic spectrum, ionizing radiations are, one is gamma rays, next is X-ray, right? Now we need to understand what investigations they release the ionizing radiation where X-rays are used. In what investigations the gamma rays acts as an ionizing radiations. The examples under the X-rays are radiography, mammography, CT scan, angiogram, HSG, that is hysterosalpingography, MCU, micturating cystourethrogram, then you have RGU, retrograde urethrogram. So these are the basic points where the investigations like radiography, mammography, CT scan, angiography, HSG, MCU, RGU, in these aspects, the radiations, the ionizing radiations used are X-rays. What examples come under the gamma rays investigations? You have a PET scan. What is that? That is positron emission tomography. You have SPECT, that is single photon emission computed tomography. Next you have thallium, where it is a radioactive tracer to see how the blood, how much the blood reaches the heart. Okay, it's a tracer where thallium. And you have a bone scan, and you have DTPA, diethylene triamine pentaacetate. Then you have DMSA, that is dimercaptosuccinic acid. Okay, so these important aspects where dimercaptosuccinic acid, diethylene triamine pentaacetate, then you have thallium, that is radioactive tracer to see how much blood goes to the heart. Next you have SPECT, that is single photon emission computed tomography. Then you have PET, that is positron emission tomography. When I start speaking about these PET, SPECT, thallium, bone scan, DTPA, DMSA, these scans, nuclear scans, they emit gamma rays. Hope you are understanding. They emit gamma rays. Now, what are the investigations which we need to look under the non-ionizing radiation? When I tell about the non-ionizing radiations, we need to understand we have MRI, we have USG scan, right? And MRI, we have MRCP, magnetic resonance. USG, it's a Doppler, it's a high frequency sound waves. So the examples under the non-ionizing radiations or no ionizing radiations, the one which uses the sound waves, or the USG, the one which uses the magnetic wave or magnetic resonance, that is MRI. Okay. Now we have a simple examples to understand. Okay. What are the simple examples here? You have something known as ERCP. Okay. That is endoscopic retrograde cholangio pancreatography. Now, what type of radiation is it? In the endoscopy, you have a camera that is a visible light. So you have a non-ionizing, right? And under this ERCP, you have an iodinated dye. When I tell it is an iodinated dye, okay, when I tell it is an iodinated dye, we need to understand this has the X-ray for the imaging, okay. For the imaging you need is X-ray. X-ray it's an ionizing. So ERCP, right? ERCP, it is an ionizing radiations, okay, ionizing radiation. So that's the basic point which we need to look into. Right. Now let us look into the next important aspect. Let us differentiate two important points. One is ERCP, MRCP, which I have already discussed, right? That is magnetic resonance, and this is an endoscopic, right? I've told you endoscopic retrograde cholangio pancreaticography, and this also magnetic resonance cholangio pancreatico, this point. Okay. Now, if you look into the difference between ERCP and MRCP, now ERCP it is an ionizing, because I have told you you're gonna put the dye and you're gonna look into this the X-ray, okay. So ionizing, you have an iodinated dye in the ERCP endoscopic retrograde cholangio pancreatography, okay. Now it is an invasive procedure, okay. It is invasive, it goes into the endoscope, okay, invasive procedure. Now what is MRCP, right? MRCP, it is an non-ionizing. Remember, it is an non-ionizing, because under this we have MRI, that is a magnetic resonance is used, and there is no dye used here. And remember that it is a non-invasive procedure. We'll be discussing in detail regarding this MRCP, ERCP, but timing you understand. The one, this is ERCP is an invasive and MRCP is a non-invasive. Now let us understand the meaning of invasive and non-invasive, okay. Now when I tell you about the invasive procedures and the non-invasive procedure, under the invasive procedure you have again divided into two. One is invasive, next is minimally invasive. When I tell it is an invasive, remember that it is a laparotomy. When I tell it is a minimally invasive, you need to understand it is a laparoscopy, right? It is a small cut is made in the abdomen. Arthroscopy, that is a knee. Thoracoscopy, that is thorax. And you have an angiography, that is endoscopy. Remember angiography, okay. So when I tell about these important aspects like a laparoscopy, when I tell about the arthroscopy, when I tell about the thoracoscopy, angiography, right, endoscopy, these are minimally invasive, right, minimally invasive. Now if you look into the laparotomy, you are opening the abdomen and you are doing a procedure, and that is invasive. Here a slight cut is made at the abdomen, laparoscopy, either in the arthroscopy, thoracoscopy. But the point you need to understand is the angiography point, okay, that is angiography. When I tell about the angiography here, now what exactly or what's happening in the angiography is you have got something known as catheter angiography, okay, you have a catheter angiography. Now what happens here is, the important point is we're gonna take the artery that is a femoral artery. When I take the most point femoral artery, since it is a straight course, this is a superficial artery and it is compressed against the bone. So this we're gonna put a catheter through this femoral artery, look into the vessels of the heart, angiography. Okay, so mostly you're gonna use a transfemoral route. And nowadays we are using a radial artery, right? We are going to use a radial artery nowadays. Nowadays we are using radial artery. That's the first basic point regarding the minimally invasive. The next important aspect, that is a non-invasive. What happens in the non-invasive is, it is a USG. Okay, USG, it is a USG. When I tell it is an USG scans, the first thing is, you have in the non-invasive, you have, say example, you have an aneurysm. Okay, suppose if you are opening, say example, you have aneurysm in the blood vessel of the brain. Now suppose if you have cut the skull and you have opened, and this is an blood vessel and this is an aneurysm, you put a clip. This is a one type of treatment where this is surgeon does this. Okay, what does the radiologist do is, the radiologist does something known as coiling it. Okay, so this is an endovascular coiling. So that is what this is a preferred treatment. It is a preferred treatment. It is an endo means inside. This is a vascular. This is a coiling. This is an endovascular coiling. That is a preferred treatment. Where does we do in the suspected aneurysm. Okay. Say example, if a patient, you're gonna suspect the aneurysm for the patient, we're gonna use this endovascular coiling. That's the first important part. That is an radiologist coil. That is an endovascular coil. The preferred treatment. It is suspected aneurysm. Let us look into the next important aspect. Okay, the next important aspect under the non-invasive, you have another category where something known as micro-invasive. And what do you mean by micro-invasive? In the invasive, which I have already discussed, that is laparoscopy, laparotomy. Okay, laparoscopy and the laparotomy. Now under the non-invasive, we have one is non-invasive, and next is micro-invasive. What happens in the micro-invasive is, we're gonna give a dye when you're taking the CT scan. So CECT, contrast enhanced CT. We're gonna give the dye and we are gonna take the MRI, CE MRI. Then you have a thallium, that is an IV, IV dye. Okay, so this is a micro-invasive test. When we tell about this is a micro-invasive test, you need to understand minimally or very micro, you're gonna give the injections. Okay, that's all come under micro-invasive. In the non-invasive, what are the points? You have an USG scan, that is a non-invasive in the USG scan. That's the first basic point. In the next important aspect, that is CT angiography, that is also micro-invasive test. Okay. The next important aspect, X-rays are not used in. Okay, X-rays are not used. So let us understand first important aspect. They have given on points. What is a fluoroscopy? Fluoroscopy is nothing but it's a video of radiography. That means, say example, the video of radiography is a fluoroscopy. Okay, and imaging in motion by X-ray. Say example, you're imaging, you're recording a video of an X-ray, that becomes the fluoroscopy. So since in this also we're going to use the X-ray. And next you have got something known as DEXA. What is DEXA, guys? Here DEXA is nothing but it's a dual energy X-ray. DEXA is dual energy X-ray. Okay, it's a dual energy X-ray, that is absorptiometry, that is a bone mineral density osteoporosis. So what is it trying to tell us is, what is it trying to tell us? He is trying to tell up regarding the it is a dual energy Dual energy is an X-ray point here, right? Dual energy, where DEXA, DEXA, that is a dual energy X-ray absorptiometry. Okay, absorptiometry. Now, what are the points which we need to understand here? Bone mineral density tells about the DEXA tells about the bone mineral density, where we're gonna use this in the osteoporosis. Okay, bone mineral density. The next important point is where the X-rays which are passing through the bone, whether they are more X-ray or the less X-ray point. We're gonna compare with the standard charts. Remember, okay, we're gonna compare with the standard charts, and you got two types of scores here. One is T score, next is Z score. Okay, one is T score, next is Z score. In the T score, remember that you have a standard young adults. Okay, standard young adults. In the standard young adults, you have a T score. Remember, and Z score tells about the age. Now, what is the difference between the T score and the Z score? Now, say example, if a 60-year guy is compared with a 60-year individual, so that comes on the Z score. But what is a T score? A 60-year guy X-ray is compared with a 30-year guy. Okay, so in this aspect, again they are divided into T score. We have got something known as normal T score, and you have osteopenia, then you have osteoporosis. Say example, whenever you take the calculation, look into the T score, and if the person has a -1 standard deviation, so if just a -1 standard deviation, and that's a normal point. Now, when you look into the -1 to -2.5 is standard deviation, that is an osteopenia. Remember, it's a osteopenia. Now, if it is below, okay, or if it is below -2.5 standard deviation, that means there's some osteoporosis going on. -1 to -2.5 standard deviation is osteopenia. -1 standard deviation is normal. Okay. Now, if you look into this Z score, that is a age matched individual, where 60 equal to 60. That means now you're comparing the 60 guy with the 60, right? So that's a simple basic we need to understand. The next important they have asked us regarding the bones in this DEXA, or okay, in the DEXA, which bone you're going to take into the consideration. We're going to take in the consideration a lumbar vertebrae, right? We got a different types of vertebrae. In this, we're going to look into the lumbar vertebrae and neck of the femur. These two bones we're going to look for the DEXA, okay, for the comparison. Now, third option, there is something known as bone scan. So what happens in the bone scan? Now, how the bone scan is done, okay? Now, say example, you have got something known as TCMDP, that is nothing but it is methylene diphosphonate, okay, methylene diphosphonate. Now, whenever you give the patient TCMDP, that is a methylene diphosphonate, okay, whenever you give that to the patient, these TCMDP, they goes into the they go attract near the osteoblast. Okay, now whenever they attract the osteoblast, remember, now this methylene diphosphonate, they start emitting the gamma rays. Okay, so whenever you look into the gamma camera, okay, you look into the osteoblast. Now that tells about the osteoblastic activity, because this methylene, M is methylene, D for diphosphonate, they emit the gamma rays. Now, in which cases we're going to use this? We can both scan. It is used in the skeletal metastasis. Okay, skeletal metastasis. So that's a third answer, where there is not an X-ray, it is a gamma rays. Now, what was the fourth option which you're going to look into this? That was CAT scan. Okay, CAT scan, where we're going to use that X-ray there. Okay. Now let us finish the session, finish the video by speaking about the how to select an investigation. Now, before you select the investigation in any question or any patient here, we need to understand the basic important points. There is something known as first investigation. There is something known as screening test, investigation of choice. You have a gold standard, you have a best investigation, you have a next step, you have a most appropriate. Okay. The first important point, that is the first investigation. Whenever I speak about the first investigation tells the investigation for the symptom, right? Say example, person come with the cough, history of some 1 month old, you're gonna go for the X-ray because the symptom it can be because of lungs. You're gonna take an X-ray. Next, I've got a screening test. Screening test to rule out the disease. To rule out the disease, rule out the disease. So that is a probability of disease is low. We're gonna rule out the disease. Screening test. What is the investigation of choice here? To confirm a disease. So done the probability of disease is high. Say example, you're gonna go with the investigation of choice, and you're gonna investigate. You're gonna use the investigation in such a way that the probability of diagnosis is high. The probability of a diagnosis of it high in such patients. And next important point, that is a gold standard. Whenever I start speaking about the gold standard, the first important concept is the most accurate. Remember, okay, that is the most accurate gold standard. That is the most accurate. It is used for the diagnostic and therapeutic. Remember, it is used for diagnostic and therapeutic. It is the most accurate. Gold standard is most accurate investigation. It is used for the diagnostic and therapeutic. Now you have got something known as best investigations. You have got something known as next step, and you have a most appropriate. So let us understand few important questions here, so that we can understand what is the next step, what is the most appropriate, best investigable standard. Now say example, you have now a 55-year-old female has a knee replacement 3 days back, and you have ICU sudden onset dyspnea, right? So when there is a sudden onset dyspnea, you're gonna go for look into the pulmonary embolism. So you're gonna go the you're gonna go with the points what investigation based, because it is a recent history, okay, just of 3 days and dyspnea. Say example, if a same patient have got a dyspnea from past 2-3 months, okay, difficulty in breathing or such, then you can mostly come under this heart issue or something. So your investigation changes based on the time also, okay. Now we'll be discussing in detail, but time being you understand what's happening here, okay. Now say example, if a patient has got a symptom and the patient has got a risk factor. So if a patient has got a symptom and the risk factor, so you're gonna first go for the investigation of choice. Now say example, the patient has got a symptom, okay. So patient has got a symptom. Say example, patient has got a cough, okay. If patient has got and is smoking, so you're gonna go for the investigation. The same patient has a cough and he doesn't have a risk factor, so you're gonna go for the screening test, okay. Now say example, the patient has got a risk factor now, and he doesn't have a symptom or something, okay. If he has a risk factor and doesn't have a symptom, so you're gonna screen itself, okay. Now if same patient doesn't have a risk and doesn't have symptom, you're gonna investigate nothing. You neither have a symptom to go for the investigation, neither has a risk factor, right? So these are the basic point you need to understand. Now you have got a question from the INSCT where the gold standard test to diagnose acute myocarditis. The gold standard, the options are endomyocarditis, cardial, and you have one MRA, okay. Endomyocarditis, they're going to remove the tissue or something, endomyocardial. Gold standard for the diagnostic acute myocarditis. The answer is that, but in the current scenario, the patient is alive, you're going to go for the MRA, So it all depends on the question. One word can change, okay. Now let us finish this session by speaking about the best video. That is, if you look into the best investigation, what is the best investigation? The best investigation tells about the gold standard is more than investigation of choice. In gold standard is better than investigation of choice. Next step can never be a one-liner. Say example, if patient has got a 45-year-old patient has got a dyspnea, that is a dysphagia, for difficulty in eating, swallowing from past 3 months. When I tell if the patient has got an dysphagia and not able to swallow in the past 3 months, remember the next step will be barium swallow, right? Next step will be barium swallow. So you can look into what actually happened, the problem with the esophagus. Once you say example, you have got a different types of barium swallow, you got a different shapes of barium swallow. In cancer you got a different shape, or you have in different diseases you got a different shape. Say example, if a patient the barium swallow looks like a cancer, right? Now what you do is I go for the endoscopic biopsy. Okay, when I will look into the endoscope, say example, if a patient after the biopsy, now it appears to be like, when it appears to be a cancer or something, go for the endoscopic biopsy. Now remember that the next step, now after the biopsy, now say example, if patient has gotten cancer, now next we need to look into this, where all the cancer had spread. So you're going with the next step is, that is PET CT, CECT. contrast in the CT. Now say example, you have got a contrast and then CT, and you're gonna further staging, further local staging, further staging point. The next step is endoscopic ultrasound, that is EUS. So ultimately we need to understand next step can never be a one liner. It all depends upon the disease, in which state you are. Now say example, you have already done with the barium swallow. What is the next step? Endoscopic biopsy. Now what you have done the endoscopic biopsy, you go for the PET CT, and you have gone with the PET CT and you want to go for the local staging, then you have to go with endoscopic ultrasound. So you will be dealing all this dysphagia in detail in the different sessions in the different subjects, but at last you need to understand next step can be an one, never be a one liner. Let us stop this session by speaking about the next step is same as most appropriate test, and remember that most appropriate investigation, it is used for the treatment stage. It is used at the treatment stage. Most appropriate is used at the treatment stage. So whenever we speak about the different aspects of different diseases, then the more clarity it reaches. Okay, so that's all in this session. In the next session we'll be discussing. Thank you.